Hello and welcome. Today, we're going to talk about a common concern for parents: fever in children. Many parents worry when their child has a fever, and there are plenty of misconceptions about when to seek medical attention. In this video, I'll clarify what fever really means, when you should be concerned, and what signs to watch for. I'll also share insights from my clinical experience, which I believe are just as valuable as what's written in textbooks. While I am not a pediatrician, before 2007, I worked in pediatric wards in 3 different hospitals. After 2007, I handled several to more than 60 pediatric cases daily in a private GP clinic. Important note: this discussion applies to otherwise healthy, full-term children with up-to-date vaccinations. It does not cover preterm infants, children with chronic conditions, or those with weakened immune systems. What is fever? Fever is not a disease. It is the body's natural response to infections and other illnesses. You may have heard that fever is defined as a temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit. That's fine as a general rule or guideline, but the reality is more complex. When assessing a child, I don't just look at the thermometer reading. I evaluate their general well-being, behavior, hydration status, etc. Why does fever cause anxiety? Most parents understand that viral infections are the most common cause of fever and usually resolve without medication. But still, fever causes a lot of fear and anxiety. I know some mothers who are doctors themselves but still feel anxious when their child has a fever. That's completely understandable. The key question is, when should you be concerned, and when can you stay calm? When to seek medical attention? Age matters. Under 2 months old. Any fever, greater than or equal to 38 degrees Celsius or 100.4 degrees Fahrenheit, requires immediate medical attention. Under 3 months old, I personally recommend seeing a doctor. Under 6 months old, I take extra precautions and assess each case carefully. I once met a mother who was confident that she could safely monitor her 6-week-old baby at home for many days despite a fever. This is a misconception. However, let's say you have a 9-year-old boy with a fever of 39 degrees Celsius or 103 degrees Fahrenheit for 1 day, but he is still playful, eating, and drinking. In that case, he can usually be monitored at home. 2. Warning signs and symptoms. The most important and easiest way to assess your child is by observing their general condition. How your child looks and acts is more important than the thermometer reading. Seek medical help immediately if your child has lethargy, dull, weak, very slow to respond, a high-pitched, weak cry or is inconsolable, a skin rash that does not fade when pressed, possible meningitis. I will explain this point further in the video. A sudden change in mental status, confusion, disorientation, severe headache with vomiting, seizures, difficulty breathing, very fast breathing or struggling to breathe or lips and nails turning blue. Poor feeding or signs of dehydration, crying without tears, fewer wet diapers, skin that looks pale, bluish, or mottled. 3. Often misunderstood symptoms. Confusion or disorientation. Feeling tired is normal, but tiredness is different from confusion. While fatigue is expected, if you find it difficult to wake your child, seek medical attention immediately. For example, several years ago, a patient walked into the clinic with a fever and headache. During the consultation, he seemed a bit confused, and his speech was slightly strange. He had no other complaints, but further investigation confirmed meningitis. Don't panic. Cases like this are rare. Just pay attention to your child's general mental status. High or prolonged fever. Some define prolonged fever as lasting more than 3 to 5 days, and a high fever is above 39.5 degrees Celsius or 103 degrees Fahrenheit. I agree that fever lasting more than 5 days and a persistent fever above 40 degrees Celsius or 104 degrees Fahrenheit may be a concern. A common piece of advice from doctors is that fever will not cause brain damage, and I agree with that. I have not found a study proving that a 40 degrees Celsius or 104 degree Fahrenheit fever causes brain damage. Still, Look at the child as a whole rather than focusing on a single reading or duration of fever. Example: a 2-year-old with a temperature of 40 degrees Celsius or 104 degrees Fahrenheit, but still playful and eating well, may recover soon. However, a 2-year-old with a temperature of 37.5 degrees Celsius or 99.5 degrees Fahrenheit but looking dull and refusing to eat may have a serious illness. Feeding and hydration. Another important aspect of a child's general condition is whether they are feeding well. Poor feeding can lead to dehydration, which is a serious concern. Signs of dehydration include crying without tears, a decrease in wet diapers, or passing much less urine. Some advice suggests checking dehydration through anterior fontanelle palpation, mucosa inspection, skin turgor, or capillary refill. My recommendation: forget these medical terms and assessments. Leave them to your doctor. I do not teach parents to do these. However, if you notice an obvious bulging or sunken fontanelle, your infant should see a doctor immediately. Neck stiffness. Neck stiffness. Often discussed in videos, but in infants, meningitis might not cause noticeable stiffness. In older children, you can ask them to try placing their chin to their chest. If they are unable to do so due to stiffness, this could be a sign of concern. However, the absence of neck stiffness does not mean there is no meningitis. Fear of light. Fear of light, a possible warning sign, but difficult to assess. Many parents come across this term online but may not fully understand what fear of light means. When a child is tired, they may naturally try to avoid light. My recommendation is to observe their overall condition, as a single sign alone can be difficult to assess. Breathing. Respiratory rate and heart rate vary with age. It is well known that a febrile child will normally have faster respiration and a faster heart rate. I don't think parents need to know the normal respiratory or heart rate. However, as mentioned, if your child is struggling to breathe, breathing very fast, or showing signs of distress, seek medical help immediately. Skin rash. A febrile child developing skin rashes is not uncommon in my practice. If you notice a skin rash, you may already know how to check whether it is blanchable using the meningitis glass test. Blanchable means the rash fades when pressed. However, I rarely teach parents to do this, as misinterpretation is common. Let me share a true story. A febrile patient initially presented with blanchable rashes on the limbs and chest during the first examination. However, during a second examination, a few non-blanchable spots were found on the back. This case turned out to be meningitis. I'm not trying to scare you. This case is extremely rare. Physical examination can be challenging for parents. Even if you perform the test correctly, your interpretation may differ from your doctor's. Moreover, not all non-blanchable rashes are easily detected using the meningitis glass test. A blanchable rash does not rule out meningitis. That's why I recommend that if a febrile child develops a skin rash, it's best to see a physician. Before a febrile child with a rash leaves my consultation room, I advise parents to monitor for any changes. Occasionally, I ask them to check for changes in the lips, eyes, hands, mucosa, or BCG scar. Bear with me. Forget the medical term BCG scar. If they notice any change, I tell them to call me instead of trying to assess it themselves. We don't charge for these calls. I believe it is my responsibility to ensure that all my patients are safe after they leave the clinic. This brings me back to my main point. For parents, the easiest and most important approach is to assess the child's general condition and look for changes. Roseola. When talking about skin rashes in a child with fever, it is worth mentioning roseola. This is a very common and benign viral illness in infants, typically presenting as a sudden fever in a child around 1 year old. The fever lasts for 3 to 4 days, and once the temperature returns to normal, a pinkish blanchable rash appears all over the body. Despite the rash, the child remains otherwise well. Cold hands and feet. I came across a video where someone said if your child has cold hands and feet, bring them to see a doctor. In clinical practice, I doubt how many doctors actually ask parents to monitor their child for cold hands or feet. Cold hands or feet alone is not necessarily a serious sign. However, If they occur along with other symptoms like lethargy, pale skin, or difficulty breathing, your child should see a doctor immediately. Fourth, others. Rare but serious cases. Fever, due to localized infections. In rare cases, localized infections cause fever. If you find a localized area that is red, warm, and tender, for example, in the knee joint, please go to the emergency department. An extremely rare example: a 2-year-old child on day 4 of his chickenpox had a high fever and complained of pain in his right forearm. Upon examination, a localized area of redness, yellowish discharge, and color change was found on his right forearm. The skin further changed dramatically in 4 hours. Luckily, this child was treated in time. Otherwise, the disease could have been fatal. Again, don't panic. This is very rare. I just want to emphasize why I ask parents to monitor for changes in rashes. Abdomen. For infants, you can gently press on their abdomen. If they scream in pain or seem very irritable, this might be an emergency. Travel history and contact history. Sometimes, travel and contact history may provide important clues. For example, if your child was in contact with a case of chickenpox a few days before developing a fever, we may suspect chickenpox even if your child has been vaccinated. Number 5. Fever treatment. First, let me clarify that Tylenol, paracetamol, acetaminophen, and Panadol are the same drug. Despite a study stating that single doses of ibuprofen and Tylenol have similar safety, I believe Tylenol or paracetamol is safer than ibuprofen. I personally do not recommend ibuprofen as an over-the-counter option. Never use aspirin for children unless prescribed, and always ask your doctor why it was prescribed. I know most doctors agree ibuprofen can be used for infants older than 6 months, but I have my doubts. However, I do prescribe ibuprofen after my assessment. When watching online information, one should have a critical mind. If you doubt my opinion, that is great. 6. Do children always need medication? No, fever itself is not dangerous in most cases. Tylenol and ibuprofen help relieve discomfort, but do not cure fever. I never object to parents using remedies or herbs, but one must be sure these products are safe. There are studies on acute kidney injury or liver damage caused by herbal remedies. Seizures in febrile children are a complex topic, which I won't cover in this video. Common questions by parents. My child still has a high fever after taking medication. What should I do? 2 hours after taking Tylenol or ibuprofen, the fever spikes again. What should I do? Can I alternate between Tylenol and ibuprofen? My child's fever keeps going up and down despite taking Tylenol. Is this normal? Can fever cause brain damage and make my child less intelligent? What should I do if my child vomits up all their medication? Can Tylenol be taken together with herbal remedies? Can giving vitamins or calcium or trace elements help speed up recovery and strengthen the immune system? Can eating hot peppers help with fever? Should my child wear extra layers to sweat out a fever? Can my child still get vaccinated if they have a fever? 2 days after the consultation, my child developed a rash. What should I do? My child is sleeping, but their skin feels very hot. Should I wake them up to take medication? Should I isolate siblings to prevent infection? My child has had frequent fevers, 4 times in 6 months. Could there be a vitamin deficiency or another underlying issue? I will cover these questions in another video. 8 final thoughts. Fever is a natural response to illness, and in most cases, it is not dangerous. What matters most is your child's overall condition rather than the thermometer reading. If you found this information helpful, stay tuned for part 2, where I'll answer the most frequently asked questions from parents. Thank you for watching. With this video, I want to express my heartfelt gratitude to all my patients for their unwavering support, which remained unchanged despite heavy rain or even a Typhoon 8 warning. Many times they waited at the clinic for more than 2 hours, yet never complained. I also want to thank all the nurses who, several years ago, worked with me from 8 a.m. to 1 a.m. for 11 consecutive days. Much appreciated.